Did you know that Americans pay way more for healthcare than anyone else? We talking about something that hasn't really been in the media as of lately. As being people who all have family members that are in healthcare work and also researching in healthcare, we feel confident in telling you about the effects of COVID on healthcare and the coverage. In today's world, healthcare is needed because we have diseases, virus, and allergies that send us to the hospital. Not having coverage is dangerous because people will just drown in debt due to them not being qualified or just not having insurance. Along with coverage, COVID has been impacting our healthcare and its workers for years and still is kind of. In 2018, according to the 2018 census, 8.5% of people did not have healthcare. That is 27.5 million that didn't have healthcare, who had to possibly pay out of pocket for any type of treatment. Did you know that this is actually more than Florida's population? So it's literally a whole state that didn't have healthcare plus a couple million. This is a big concern because this is 8% of people who had to pay out of pocket or did not go because they just simply couldn't afford the bills. It's concerning because with younger people, according to the 2018 census, out of ages from 19 to 25, it was increased of people not being insured from 2017 to 2018. They had the highest percentage of not being insured in 2018 and the second highest for increasing. That is why in the 2018 census, they say that most people get their health insurance coverage through their spouse. This is why health coverage is related to marital status. According to the 2018 census, married adults from 19 to 64 were more likely to be insured than any other group. The group that was least likely was the ones that were separated from their spouse. I personally know this only because I had to switch plans back when I was a little bit younger because my parents had split and they just ended up moving insurance companies. This is very crazy because it's thinking about how people had to actually go out of their way and go out of pocket for paying for insurance, and medical bills are very expensive. And with COVID, it hasn't helped at all, which brings me to my next topic, the effect of COVID on our healthcare.
The coronavirus has made an impact on healthcare that we have not seen since the Ebola outbreak 8 years ago. International hospitals and healthcare facilities are facing catastrophic financial challenges relating to the COVID-19 pandemic. The American Hospital Association estimates a financial impact of 202 billion in lost revenue for America's hospitals and healthcare systems, or an average of 50.7 billion per month. The United States only has 4% of the world's population, but as of July 16, approximately 26% of its COVID-19 cases and 24% of its COVID-19 deaths. These startling figures reflect a deep crisis in our public health system. Put simply, the government failed to quickly identify and control the spread of the novel coronavirus. The United States did not make testing widely available early in the pandemic, was late to impose physical distancing guidelines, and has only recently implemented both on a large enough scale. The coronavirus not only affected the state of our healthcare system, but also our healthcare workers.
Healthcare workers have been at the forefront of the fight against COVID-19 ever since the virus came to the United States. After it initially began back in March of 2020, healthcare workers were presented with the difficult task of helping and working with COVID patients, all while still maintaining a safe environment of their homes and families. According to the Lancet, a credible medicine source, healthcare workers and clinicians were faced with avoidable stresses, as many workers were needed throughout various medical facilities across the nation. With rapid increase in COVID-19 patients, many healthcare workers were forced to seek out quarantine to isolate themselves because of the higher contractions. As many child and healthcare workers, as a child of a healthcare worker, I have witnessed firsthand the detrimental effects that COVID-19 has had on everyone, including my family. My mother was in quarantine while tending to patients infected with the viral disease. This restricted my family accessing and being within the same vicinity as my mother. ICU healthcare workers were equipped with personal protection equipment, PE. This was hospital issued coverage that protected their entire bodies, including their eyes and hands, which you see below. This equipment provided insufficient, seeing as the numbers were exponentially increasing, not just in patients, but in healthcare workers as well. However, with insufficient equipment and non-existent cure at the time, healthcare workers were put under stress and they had to comfort dying patients as well as colleagues who contracted the virus.
The world we live in today requires that you have healthcare for the worst possible situation. With the arrival of the coronavirus, several issues regarding healthcare also turned up. From coverage to healthcare and its workers, the virus has affected all these things in a major way.